now, so when it's not your turn to talk, you can mute if you want to.
The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, and welcome to the ISPCAN International Webinar Series. We're so glad you could be with us for this very special installment with our president, Bernard Gerbaka. He is with us today, and he is traveling in the airport and scrambling to make it with us for his cyberbullying presentation today. So again, thank you for your patience, and Bernard, thank you so much for being with us today. Now, you can ask questions throughout in our chat box. You will be muted, so you can type your questions and we will take them for Bernard at the end. And we'll tell you a little bit about our honored president right now. Dr. Bernard Gerbaka is a pediatrician, chairman of the pediatric department, director of the pediatric intensive care unit and pediatric emergencies Hotel Dieu Hospital, Beirut, Lebanon. He's an associate professor of pediatrics in St. Joseph University, Beirut. In 1998, he was elected member of the City Council in Beirut, and since 2003, he is the Lebanese correspondent and co-founder of the Arab Professionals Network for the Prevention of Child Abuse and Neglect. Now, with ISPCAN, he participated in the ICAST field test and implementation, and also contributed to the United Nations Secretary General Study on Violence 2004-2005. And right now, Dr. Bernard Gerbaka is coordinator of the Lebanese Task Force for the Prevention of Child Abuse and Neglect and Violence Against Children, the Higher Council for Childhood in Lebanon, Higher Council for Childhood in Lebanon. So we are so appreciative of his time and his service to our International Society for the Prevention of Child Abuse and Neglect community. So Bernard, we'll go ahead and let you get started here.
Good morning, and thank you, everyone. It is really thrilling for me as I'm discovering this webinar as a tool for sharing experience. I will try to share mine, mainly in the Arab region, and concerning building up the case of bullying and cyberbullying and the necessity to address this issue as a major type of child abuse and neglect. So again, thank you all for your patience, and thank you for being here with me. I will learn a lot from you, as much as I will try to share my own modest experience in the field.
Bernard, can you go ahead and accept the invitation to show your screen? Perfect. There we go.
So shall I start?
Yes, go right ahead. We are all ready.
Okay, thank you. So bullying and cyberbullying is one of the types of child abuse and neglect. And obviously, it is a type that is not well known because people usually think, even among professionals, that this is the kind of thing that is an adolescent language and they will outgrow it, like they do with anything that comes with adolescence. The problem is that sometimes they don't, and sometimes they keep like lifelong consequences of the time when they were bullied or cyberbullied. And as you may see also in the news, this type of child abuse and neglect can lead to early death, either by taking your own life. You know, adolescents did commit suicide after being bullied and cyberbullied. And there is some kind of understanding among health professionals that we need to do something about it. And in the Arab region, there is poor data, but some data to start our own reaction towards the problem. So all along the slides, I'm going to take you through the presentation, and I would like to start by thanking Marta Santos de Pais, who is the UN Special Representative for Violence Against Children. She did trigger the UN report, and before that the UN study on cyberbullying and bullying. And it was a global outreach in 2016, and it did provoke a standalone report on behalf of the United Nations that we can use in our different backgrounds as relevant, and that we can also use as tools for advocacy and tools for education and tools for awareness raising, as much as we can use them to address families and even adolescents who are main targets but also main victims of bullying and cyberbullying. We need to understand what is the consequence of bullying and cyberbullying on children. Maybe I will share some of the specificities in their region, but let me tell you one thing: children react the same. When they are bullied, this is emotional abuse. This may be physical abuse, and this is long-lasting wherever you are in the world, and whatever language you use in bullying a child or in being bullied by another child or by an adult. We need to understand the risks of bullying and cyberbullying, because there is a prevention. It is mostly an attitude, and I wouldn't say a culture, but it's also a knowledge. It's a minimal knowledge, but it's a basic knowledge that is enough to address the problem of bullying and cyberbullying. We also need to understand that there is a legal frame, because the UN Convention on the Rights of the Child was reviewed, mainly it's Article 19 a few years ago, and all countries who are signatories of the CRC did go through the Global Comment number 13. And when you have a look at the Global Comment number 13 about Article 19, which addresses particularly the violence against children, you will see that bullying and cyberbullying are considered by definition and in the core of violence against children. So what can we do as health sector, as social sector, as education sector, as legal sector, and mainly as a multidisciplinary team? What can we do to address the problem of bullying and cyberbullying? And at the end, how can we share between each other the outline of a plan of work, and maybe enlarging the platform to become more efficient and more multidisciplinary when we address this problem? So, you know, the Global Partnership to End Violence Against Children has some components, and it was launched in New York in 2016. And it does address in 16.2 that we should end abuse, exploitation, trafficking, and all forms of violence against and torture of children. And points 5.2 and 5.3 address public and private spheres, and also addresses all harmful practices, in which we do include bullying and cyberbullying. And at the end, there's also the obligation to provide safe, non-violent, inclusive, and effective learning environments for all, because in learning, in education, this is where we find the root for prevention. And we also, as we address learners and as we train the trainers, we need those learners to acquire the knowledge for the promotion of a culture of peace and nonviolence. And the end point is to significantly reduce all forms of violence in making the livelihoods of children inclusive and safe. So this is the framework that was launched by the Global Partnership to End Violence Against Children and the UNICEF, and mainly Susan Bissell, who is chairing this and who is leading this UN role. And when we have a look at the typology of violence and where bullying and cyberbullying can fit, you can see how wide it can get and how deep it can get into the life of children. It can lead to self-harm, to interpersonal harm, to collective harm. And you know that bullying can become collective, either by collecting children against one child, or collecting children against other types of children for any reason. Maybe too short, maybe too long, maybe not white, maybe white enough, maybe anything can be a reason to bully a child. And those victims are usually selected. And let me tell you one thing, the bullier is also somewhere a victim, because usually they don't succeed. The bullied child and the bullier not really succeed well in life when it has not been taken care of. So both of them are victims, and the earlier we deal with this, the earlier we settle this problem. And there's one third victim. It's those who watch. You know, the sidewalker? Those who watch also become victimized by the bullying and the cyberbullying for many reasons. Sometimes because they did not do anything, sometimes because they encouraged the bullier, sometimes they would say that they did not defend the bullied child enough, but they do keep consequences about the bullying and the cyberbullying. And as you know, this pyramid, you know that adverse childhood events will ultimately lead to early death, and the quality of life will be affected. So you can see it's also been in newspapers, in magazines, and you can hear about many children who have been subject to emotional neglect, to emotional abuse, and those have a higher risk for suicide, smoking, and behavioral risk, drugs, drinking, underage sex, many partners physically inactive, and so on. Name it, you can find it. And if you know this black spot, you know this is the black spot that touches many many images and many layers in our own life. Our somatic life is affected and our mental life is affected. So the children who have been affected by adverse childhood events will be more affected with heavy drinking, with HIV, with mental problems, with family issues, with cardiovascular disease, cancer, and so on. They will have sleep disorders, appetite disorders, eating behavior change. They will have impulsive behavior. And some of those signs are suicidal risk signs and help us in screening depression. So sometimes when the adolescent is acting odd, unusual, even if a little bit unusual, it can be in relation with his growth and his developmental cognitive skills, but can also be in relation with something hurting him continuously, persistently, and deeply in his life. So why about adolescents? Because we presume they are in good health, but often they are not. Mentally, physically, we presume that they are in good health. But when you have a deep look at preventive health, you can see that they not necessarily have good vaccinations. They don't necessarily behave well in terms of risky attitudes. And they can have mental health issues. So there's this paradox in their life. They are uncertain about things and paradoxically seem very certain about them. They want to be separated from their family and yet are so sensitive and have issues with this autonomy. So preventive care visits are an opportunity for us to address all those issues. So what is the definition of risk? Is it being LGBT? Is it having some physical challenge? Being in a family at risk, a dysfunctional family? Having a phone or a computer? Going to school? Being adolescent, or simply having a brain? So obviously adolescence is in the turmoil of bullying and cyberbullying. And when you have a look at their developmental skills, you can see that there are periods during their adolescence where children have different skills but also different vulnerabilities. In early adolescence, there's a peer group influence. In middle adolescence, there's an effort to make new friends and frequently changing relationships, and they get more stable interest later in adolescence. So depending also on the time of adolescence and the period that the child is going through, their responsiveness can be very different. So for example, LGBT, we know that those children can reveal earlier than we think in life, and they are at higher risk of depression and at really higher risk of suicide. And trying to change them makes things worse. So there is obviously an attitude that we need to have and that families need to have towards them into being more inclusive, more understanding, and less caring about trying to change them because maybe they don't want to be changed. Maybe they're happier to be accepted as they are. This is just one example of bullying and cyberbullying that concerns children. So I would like you to have a look at this slide and try to see what those children, most of them are children, there is one adult, which is the hint for the slide, what do they have in common? In fact, they have two things in common. One of them is that they are all smiling. And the second thing is that they are all dead. So, you know, the quality of the smile is important. And just having a smile on your face does not mean that you are well inside. And it is important that we allow children and encourage children and empower children to share their weaknesses, their feelings, their fears, their anxiety. And you can't do it just by seeing a child 5 minutes to do it. You can do it just by being here for a few minutes as a parent or as a teacher and just looking at the smile and being falsely reassured that everything is fine. So the natural helpers can really induce a responsiveness from the child to a wider and a more professional community, like us pediatricians, social workers, lawyers, education specialists, and so on, nurses, midwives, mental health specialists. We all need to understand that the burden of bullying and cyberbullying is so important on children to detect this very early and to seek not only for parental support, which is very important, but also for professional support as soon as possible. In the Arab region, we have some studies that have shown that bullying can occur to children based on religious belonging, physical appearance, and even perceived sexual orientation. Physical appearance can go up to mass media that glorify violence among children, which makes it easier to use it as a language between children. Being violent can become a language among children because we as role models in the region and elsewhere are giving them that image. So in Turkey and Israel and Iran and Oman and Saudi Arabia and Lebanon and United Arab Emirates, some studies have shown that bullying is a concern among students. It can go from 15 to 20%, and in some of the studies, even in light bullying, 3/4 of the children have reported bullying. It can be verbal bullying and sometimes get physical. And one of the indicators is being absent at school. This is one of the studies in Oman. Being absent more than 7 school days is higher among bullied children. And usually perpetrators are older than the child, but not necessarily much older. So this slide shows one of the studies that displays a difference between 30 and 50% globally, or 45% being the average percentage of bullying in each country that are present on that slide. So obviously there is more interest now, although we had issues with definitions. We don't use the same wordings, so it took time to find some adequate wordings that can fit the Arabic terminology of bullying and cyberbullying. And there is actually more interest in studying bullying and cyberbullying because obviously we belong to countries that are very much social connected. If you have a look at connections like Google or Facebook or Twitter, you will find among the 10 first in Arab country, or even more than one, you may find 2 or 3, even among the 5 countries that use mostly the social networks. So as you can see on those slides, you don't need to have a deep look into the numbers, but you need to be aware that we are more concerned now, and we are giving more importance to bullying and cyberbullying as being a major issue in the life of adolescents, because it can lead to death. It can lead mainly to suicide, and it can lead as an adverse childhood event to later problems in mental health and in somatic health. So the challenges now are in the Arab region that we need more research, mainly action-oriented research. How do we address as a prevention bullying and cyberbullying? How do we define them in the frame of laws? And how do we get them to become less misunderstood and more integrated into the curriculum of child? Because obviously in schools and all education institutions, even universities, we need to implement more the rules and regulations in order to address bullying and the prevention of it. So as you are all aware, the Sustainable Development Goals are due in 2013, and we really need to be ready in all those targets and all of those indicators in our different countries where we live. And if we see some of those points, like ensuring healthy lives across the life course, being inclusive and equitable, and providing education for all, promoting inclusive societies, and participating to global partnerships, we as professionals have a role to play, whether it is in the health, education, social, or legal sector. And the Agenda 2013 aims to end violence against children. The vision, the goals, and the targets can be found on WHO website. It can be found on the UN website. And on the WHO is also you can find the INSPIRE framework to address violence against children. And also you may want to have a look at the UN report that was edited in Florence by the UN Special Representative on Violence Against Children about bullying and cyberbullying. One of the big inspirational examples is Malala. As she was bullied, she became the champion against bullying and promoting children presence in school. So we need to have the public health approach and have a look at the societal causes, the community causes, the interfamily relationship, and the individual causes of bullying and cyberbullying. And we have selected in Lebanon to introduce more of adolescent health, more of definitions of violence against children, and more of mental health in the Lebanese health record that was edited in 2016, because we believe that adolescents are not necessarily going well, mainly in the Arab region. And we need to provide guidance for parents in how to approach their adolescents, because they would say that he's an adolescent, he will get out of it in 3 or 5 years, and I will get him when he gets out. You may not find him when he gets out, or he may not get out. So it is important that earlier as possible we discuss normative psychological development and adapt our parental skills and practices to meet the children's needs. We need to be involved as parents, and as professionals we need to guide parents into being more involved into the understanding the adolescents' behaviors. Also, this is a difficult thing. No one is perfect. Who can be a role model? Who am I to judge? Again, but we need to be aware that what we do is something that can be replicated and amplified. We need also to discuss online potential for abuse, and this is what cyberbullying is about, and discuss anything positive and negative with the child so that online issues are part of the discussion. So we need also to take seriously any comment that children can have about their bullying, because we can't say, yes, you have to manage this by yourself, you're big enough. So as an example, the pediatrician competence refer, report, and testify about cases of bullying and cyberbullying, and integrating definitional issues within the whole framework of bullying and cyberbullying. Also, we need to develop child protection units in our hospitals, in our healthcare centers, in our schools, so that we can also approach preventively and as an educational tool bullying and cyberbullying, and also provide positive attitudes for parents and for let me say positive parenting, positive schooling. So also whether it is informal or informal type, we need to approach education and training for all professionals in different sectors who work with children. And gender examination and file. So when you file an adolescent, you ask about vaccinations, about smoking, drugs, alcohol, whatever, whether he would like to be alone, or whether he would like to be with his parents, is something that belongs to your cultural background and to the family's choice, and also and mainly to the adolescent's decision, how he feels comfortable. Because if he doesn't disclose when he's not comfortable, you won't learn much. So maybe you need to provide him some privacy and have some person-to-person discussion with him at some time during the discussion. So depending on your cultural background and the legal framework, this can be the whole consultation where you spend P2P with the adolescent, or part of the consultation and the medical visit when you spend some time with him. So as soon as you learn about it, it is important that you address prevention, whether talking to the parents or to the schools. Information is important for parents, for institutions, and for peers, because as I said before, bullied children will not feel well, bulliers will not feel well, and bystanders will not feel well. We need to understand that research is very important, and one of the research tools is the ICAST instrument, and other tools also are provided by the UN Study on Violence and the Global Partnership. Also, you may want, as I said before, to have a look at INSPIRE framework and to address early child education, because as it goes, bullying can start as early as nurseries, even in preschooling. When you detect the victim, he can be victim today and victim tomorrow and victim always until it disappears completely, or until they change the school, or until something really bad happens to them. And this also can be part of the prenatal consultation. And we can also address, among other many things, during pregnancy education, parental skills with children, how to best provide our children with educational tools and with self-confidence. So home visitation for families at risk is also another tool. The curriculum outline that ISPCAN provides includes safety at school and bullying and cyberbullying. And I would very much like to see this developed as a standalone module so that we give more tools for practice on bullying and cyberbullying in the prevention of school violence. So why we fail to report many types of violence, why we fail to report, either we know the family, because the family may threaten me, may bully me, may not return to me, or there is not enough to report. What if I'm not sure? What if I may do more harm to the family? What if this is the child's fault? This is some of the usual examples that we give. It's blaming the victim. What if we say that parents are vulnerable, so they don't have this? You know, with hardships, you can find a lot. And when we have a look at those refugee children, you can be amazed by the number of types of violence against children that are exercised on those children. And what will come out of it, we don't know, but it's not going to be easy and it's not going to be good. So you can't fix it yourself. Being in a team is much better than being alone. And as a pediatrician, or as a health worker, or as social worker in the legal sector, education sector, you can't fix those things alone. You need to have institutional support, and you need to have a platform of professionals that can address those problems. So bullying is everywhere. It is not about a culture. It is not about a religion. It is not about a color. It is not about a country. It is within us, whether we accept it or not, wherever we live. And the more we work together, the more we can address this effectively. It is more difficult to prevent than other types of bullying, because cyberbullying is prone to happen 24/7 because of internet's availability. And it can be perpetuated. And you know, once the picture is out, it is out. And the harm is very difficult to get back. So it's like, you know, bullying is like when you throw sand in the face of children. So when you want to repair it, you need to pick up each grain of sand that you threw at the child's face. So prevention is very important. And many countries are now encouraging children to report incidents and teachers to talk about bullying and cyberbullying as a type of violence against children. Schools should be urged to help stop cyber attacks by adopting an internet safety policy. And I know that this is an issue. When you sell a computer, it should be child-friendly by default and not, it should be built in and not add in. So this is one of the ways to address it, but the major role of parents in providing their children with strong tools, with positive parenting, and schools in providing educational tools and safe schools skills are the way forward. We need to see it as a tertiary preventive health, but we mainly need to see it as a primary prevention approach. It is one of the most difficult, pervasive, and prevalent problems that families and schools face today. Victimization is often associated with ACE, and it can lead to early death. Students who are the target are likely to avoid going to school, and the assessment and further prevention need more attention from decision makers in all our countries. Tomorrow is today, so we need to include bullying and cyberbullying in the global frame of Article 19. We need to have a look at adolescent health requisites. We need to include children and youth in the study of bullying and cyberbullying. So it is important that we have youth participation. I have learned a lot from adolescents who talk about bullying and cyberbullying, maybe more than I learned about experts. So because they will tell you really the feeling of it. And the health research should include mental health and include also bullying and cyberbullying. Pediatric groups also are challenged, like the International Pediatric Association, like the national pediatric groups, and as a pediatric society, we did have a position paper on bullying and cyberbullying, and I think that other pediatric groups can do the same. Socially and educationally, school child protection units are also part of the protection system, and providing parents early positive parenting skills is also another tool to go forward. This is the INSPIRE framework. You can find it when you visit the website of the WHO. So obviously we'll be better off in parenting, in response services, in laws, in values change, but we really want to see all types of violence against children go down. So obviously sexual abuse has gone down because perpetrators have been also prosecuted. So obviously there is a legal part of bullying and cyberbullying that we also need to address, but we can only do this if you do it in an integrated form by providing parenting skills and also banning bullying and cyberbullying. Thank you very much, and thank you for bearing with me, because obviously you are aware that I'm in an airport, and so thank you very, very much for being patient with me.
Oh, Bernard, it was a wonderful insight from you, and you sounded great the whole time, so we really appreciate it. Distractions were quite minimal, and we're appreciative of that. But we're going to ask a few questions now, if you have just a few more minutes. And
Sure.
one of them, so much of this puzzle does lie with the parents, but what if the parents or the environment are not positive and the child does need to help him or herself?
You know, the Denmark thinking space, which became now the ISPCAN thinking space, has studied corporal punishment, mainly in a punitive way, like we need to ban corporal punishment, which is very important because you need a legal frame. And then we had more insight from experts who are specialized in education, in mental health, in social sectors, that we need to approach parental skills. And you know, when a mother delivers a child, this is not a good moment. She's in pain, she's concerned by a lot of things, so it really should be prenatal. So prenatal visits are important. Home visitation of parents at risk is important. Meeting with parent groups in schools are important, and even in nurseries, because the earlier you address early child education, and the better off the child is.
You also talked quite a bit about the need for further research. The research that's already been done, is it self-reported by young people? What ages have been looked at? Where are the gaps in the research?
The gaps in the research are mainly mixing together different cultures. And I think that why, if we mix together, but it's just a supposition, we may find similar results. So we need to put together, and ISPCAN has this strength through regional resource centers to put together what is cyberbullying and bullying in Africa? What is it in Middle East? What is it in Europe, in South America, North America, and Southeast Asia? And how is it comparable? So this can be the subject of an ISPCAN thinking space, so that we can accompany the UN report on bullying and cyberbullying and the global partnership to end violence against children. And one of the components of INSPIRE is providing parents parental skills, and schools education skills. So there's a big role that ISPCAN can play through the professionals, through the country partners, and through the regional resource centers.
We certainly hope we can do that, and the thinking space that you mentioned, we're very excited for this topic to come up there. The percentages that you mentioned from the Arab region in terms of cyberbullying, do you think those are higher or lower or on par with global averages?
I don't think that there is enough data to say that it is higher in the Arab region, but obviously it is now a big concern in the Arab region, because there's a high prevalence of connection to the social network. And as it is a conservative society, when you oppose, it's like putting flames on ice. When you oppose a conservative society with such a social opening, the consequence of an individual bullying and cyberbullying can be disastrous, rather than a society that is more in the line of discussing those issues. So it is a concern, and I think that the sooner we try to normalize the Arab society as being another society with different languages, with different values, but where bullying and cyberbullying is a problem like anywhere else in the world, and the sooner we will get to prevention.
We have a question from Chrissy here that you kind of touched on, but she's asking, with early childhood education on bullying, at what age is it appropriate to start teaching about bullying?
You know, when you glorify violence, you provide children a role model that can get to very low ages. And we did see that the age of bullying and cyberbullying is going down from late adolescence to mid-adolescence to early adolescence and to pre-adolescence. You can see also cases of violence against children going that young. And I think that early child education is not only a period where we should teach children to be protected, but where we should also teach children prevention and what is normal and what is acceptable and what is not. This is also an opportunity for teachers to learn that and to integrate that in their educational methods.
We also have a comment from Stella, who is saying how alone teenagers can feel. And much of the time children and adolescents are alone, they're separate from the parents and adults, and they feel like strangers, and as we do get more cyber dependent around the world, do you think that's becoming more true, the loneliness?
You can be alone in a pool, you can drown in a pool where there is 100 people. Children will not show you their loneliness unless they are really very much alone. And sometimes you discover then their loneliness when they commit suicide. Sometimes parents and the environment of the child didn't have a clue about what was going. If you get back to the slide with their faces with a smile, you know, we have this adolescent with us on the preparation of the UN report on bullying and cyberbullying, who said to me, "You are so right, because my therapist would tell me, wipe that smile from your face." And it is important that we just don't have a look at the picture, but at the whole movie of how the child is behaving, and giving importance to some of the red flags when the child behaves differently, has anger issues, is absent from school, talks less with the parents. You know, those red flags that allow us to learn that there is something persistent going on, and rather than asking to the child, is there something wrong with you, the children think that what is wrong is with them, not with the others, until it's too late. And so it's important to have a preemptive discussion with children so that there is a bridging between children and adults, whether as parents, as pediatricians, or as educators, or in any profession that allows us to work with children, to facilitate the smooth discussion with child, and rather than being judgmental on whatever they say or think, but trying to understand more of the background of why they are saying or doing this.
We have Satvika asking now about the responsibility of some of the companies, the technology companies, Facebook, Twitter, social media, in looking into the online abuse, combating cyberbullying. What should the level of pressure be on them?
I agree with those who think that the media tools such as the telephones, internet, your laptop should be child-friendly built-in. I also agree that there is a responsibility, and I think that there is some perception about this, that those who lead those social media need to include in their system tools to detect early signs of bullying and forbid bullying as much as they know and can in their own systems. Because as I said before, once the picture is out, it is out forever. And it is very difficult to get back. It's like throwing sand in the face of people. On the other hand, I'm not the IT specialist to tell them how to do that, but as ISPCAN is one of the most important international organizations that is connected through regional resource centers to more than 140 countries and to 1,200 members, I think that we can build the momentum and also the advocacy tools so that we can help professionals address in their own countries decision makers so that we can firewall cyberbullying against children.
As a parent, I'm wondering, is it important to limit exposure to social media, or is the education about it the more important piece?
Well, I don't know, because I will react as a parent, and adolescents may not agree with me that we need to limit the time of social network. But obviously there is some understanding rather than rules that needs to come up between parents and adolescents. And the earlier you do it in life, the smoother the rules may continue. And obviously, even when we allow 1 or 2 hours of TV or whatever screen to small babies and children and toddlers, it is important that we are aware that leaving them alone with the screen working is not necessarily a good thing. We need to interact with them at those times because they need to make and learn very early in life, because this is where the imprint on their brain occurs. We need to teach them early in life to those children, and this is part of early childhood education, that we limit this and that we interact with children during those sessions when they are in front of the TV. It is not a space of peace where you put a child 2 or 4 hours a day. It is not.
I think most would agree with you on that, certainly from a professional standpoint. I'm just curious, Bernard, was there any particular event or impetus for you becoming so interested in this particular subject in your practice?
Yes. Suicidal adolescents, I think it's a very good driver for anyone who encounters this in real life or a threat of suicide. I think that no one wants to learn the suicide of an adolescent in his own environment. What we learn from the media is shocking enough, so that we as professionals, as we have more expertise, as we have more outreach to decision makers, but also to parents and families, have a role. And this is what ISPCAN is about. ISPCAN is about 1,200 members who are all volunteers and who do good things in their own backgrounds and countries, to which they are not paid to do because they want to, and because they learn to do it, and because they do it well. At least in the Arab region, in spite of all challenges, I think that they are doing good. So it is my understanding also, now that I'm president of ISPCAN, that in all regions of the world, our regional resource centers are doing a great job. And as we did address sexual and physical abuse, we also address corporal punishment. And I think that online sexual exploitation, child trafficking, and next also will be probably refugee children, and also violent children, children who kill other children, the gang children. Now, those are ideas to explore later. Now we have this issue of bullying and cyberbullying, on which I think we have a role to play.
Well, Bernard, we so appreciate your time. I can see on your screen you have a low battery, so we will let you go. But so insightful, and I will remember, and as I'm sure all of our viewers will, so much about what you said today, and hopefully in the coming year ISPCAN can have an even bigger role in fighting this problem, along with our resource centers and our youth council, which will be starting soon as well. So safe travels to you.
I want to thank the staff for all you did to help this webinar come through. And I want also to express my gratitude to all those I don't see, I don't hear, who have been patient with me and who provided me the privilege of sharing some of the ideas with them.
Thank you so much, Bernard. We will talk with you soon, once again.
Thank you.
Take care.
Bye.
And we appreciate those of you who have stayed with us. We'd like to ask you to go ahead and take a look at some of our membership benefits, and those will all be in your handout section as well. And we will actually be launching our new website. The address will stay the same at www.ispcan.org. And so we hope that you will join us on the new, even better service website, and will consider membership in ISPCAN. We are growing the benefits for members every single day. So thank you so much for taking time to join us today and learn more about cyberbullying. We are always pleased to welcome you to social media and to our website to engage with us more. We hope you have a wonderful day.
Thank you.